Hey, I'm Dr. Megan Summerall-Lott, optometrist at Belle Vue Specialty Eye Care. So often I get asked, what is vision therapy? What is special about your eye clinic? What makes Belle Vue Specialty Eye Care special? So I'm going to do a video today just to let you kind of know what it is that we do here that does set us apart and make us different from other eye clinics. The first thing that we do is we say we go beyond 20/20 vision, and there are over a dozen visual skills that are needed to be an effective reader. And so what we do is we are actually looking at those skills where most eye exams are really going to put their focus on achieving 20/20 vision. What we put our attention on are the other things. Can the eyes focus together? Can they focus clearly from distance to near? Can the two eyes fuse an image together so you're not seeing double, or your child isn't closing an eye or covering an eye whenever they're reading? Can they track efficiently? Do they not skip letters or skip words or skip lines or lose their place whenever they read? That's what we want to achieve, is good tracking skills. We also look at perceptual and also orientation. Is a child just seem overall clumsy? Are they not very good at sports? A lot of these could be some visual motor components as well that many times people don't consider. So how can a parent know if their child may have a vision problem? Well, first of all, 1 in 4 children have an undiagnosed vision problem. That's a lot. 1 out of 4. These children may need glasses. These children may not need glasses. These are the children that are going to be missed during a basic eye screening. So we have a very easy checklist that a parent or a teacher can do for a child. It's also on our website, www.bellevuescc.com. But on this checklist, there are 19 questions, and they range from headaches with near work, omits small words, writes uphill or downhill, reading comprehension down, holds reading too close, trouble keeping attention on reading, difficulty completing assignments on time, forgetful poor memory, head tilt, closing off when reading. If this sounds like your child, please, I encourage you to complete a checklist. Whenever we detect that a child may have a vision problem, we may prescribe glasses. They may be for all the time. They may be for just reading or classroom. A child may also need vision therapy. And what vision therapy is the same as any other kind of therapy or rehabilitation program where we are teaching the brain and the eyes to work together. In her book, there is a book that I really, really love. If you can pick this book up, I recommend it. It is The Hidden Link Between Vision and Learning. It's written by Wendy Beth Rosen. And Wendy Beth was an elementary teacher whose child had difficulty in school and needed vision therapy. And in her book, Wendy Beth states, to fully grasp the reality of how the root cause of a child's struggles may be incorrectly diagnosed, consider that 15 out of the 18 symptoms linked with ADD, ADHD are also associated with a vision disorder. 13 out of these 17 symptoms of dyslexia can occur with a vision-based learning problem. That's a lot. That is a whole lot of symptoms that could be these visual symptoms that we are talking about. So before a child has a label or is prescribed medication, please, I urge you to have their vision checked beyond 20/20. If nothing else, complete the checklist and see if it could potentially be a binocular vision problem that we here at Belle Vue Specialty Eye Care could help you with. I'm going to read you a couple of inserts. We have a little book that we ask parents to write in whenever we complete vision therapy on their child. And I'm going to read a couple of these just from moms like you and me that they've said about the therapy that the child received here. Words cannot describe the change you've made in our son's life. You've opened his eyes and made school enjoyable again. Our family will forever be grateful for God placing the two of you in our lives and allowing you to share your great expertise and wisdom. Your knowledge and true concern for my son will have a significant impact on his successful future. Let me read you another one here. There are no words to express the gratitude I have for the both of you and the help you have given our son. We will forever be grateful to you both. I only wish we had known about you sooner. Thanks for making such a difference in my baby boy's future. These were both moms who they knew that they had a very smart child, but their child was struggling in school. And us as moms, we don't want to see our children struggle at anything. School is hard enough. Life is hard enough. We want to make sure that we give them all of the tools that they need to be successful. I'm not saying that vision therapy will make your child an all-A student, but when you look at the statistics that 80% of learning in a classroom is visual, that's pretty eye-opening. And these are things that need to be detected. Another question we get is, how old does my child need to be before they begin vision therapy? The American Optometric Association recommends that a child's eye exam be by the time they're 12 months old. I personally like a child to be somewhere between the ages of 6 and 12 months for their first eye examination. The reason being is because by 6 months, the child should have full control of their eye movements and their eye teaming. I began vision therapy on my own child at 9 months of age because I noticed that there was a problem with his two eyes teaming together. There was a little bit of an eye turn or a crossed eye there, and at 9 months old we began therapy, and within 2 months his eye, I no longer would see that eye turn that was coming in and out occasionally. If your child is struggling in school, struggling in sports, please bring them in and let us do an evaluation on your child. I'd love to meet you. Any questions that you have, please post below. Send us an email. Our email address is hello@bellevuesec.com, or just stop in the office and meet us. Thanks for watching this video.